Delays in TTOs are one of the key reasons why patients don't go home on time. There are so many steps involved, it's important that the process is started as early as possible and that every step follows on as quickly as it can to make sure the patient goes home without delay.
Okay, let's look at the drug chart.
So the first part of making the TTOs is actually deciding that the patient is ready to go. Ideally, you're trying to think about that at least 24, if not 48 hours before they go. The junior doctor needs to then get the TTOs done, and now that may involve them actually leaving the ward round. Ideally, trying to get those TTOs written and down to pharmacy before 2 o'clock the day before they go home. The junior then types out all the medicines to make sure that they're all accurate. They then take the drug chart with the printed list of TTOs, and the ward nurses then go through a series of checks to work out which medicines the patient already has in their bedside locker, which medications we already have on the ward as TTOs, and anything that isn't there then needs to go down to pharmacy. When they get to pharmacy, there are obviously processes that they need to go through, which is dealt with in another video on this training programme. Once pharmacy have completed the medicines, they are then sent back up to the ward. They then have to go through the process of checking again that what's in the TTOs is accurate, and sometimes merge that with some of the patient's drugs that are in their locker, checking them one last time, then going to the patient, talking them through what all the drugs are, what the medications mean, and then finally the patient is then ready to go. Hopefully this has given you an understanding of the number of steps involved in making TTOs happen, hence the reason why it's important to start the process as early as possible to make sure there are no delays in getting the patients home.